And I am bloody mad at health insurance companies. And the reason they get away with doing what they do is that nobody really has any idea what they do. They're under the radar screen. And if you get under the radar screen in Washington, you can do pretty much whatever you want. But there are two ways of getting at it. One is this public option, which I've really thought hard for. And continue fighting for it, but that creates competition. They don't have competition. They're kind of an oligarchy. They're unto themselves. Half the states, we have 50% of our people are insured by 2 health insurance companies. In Alabama, 90% of the people are insured by 1. So they don't really have to worry about competition. So our premiums go up, their profits go up, and our health care goes down. And it's not fair. There's another way of doing it, and it's got a wonderful name to it, which I won't use. But they have this law in Nebraska and in several other states, and I'm going to try and, I tried to make it law in the Finance Committee, but I sort of couldn't get it brought up properly. But it's called medical loss ratio. Now, if that doesn't stimulate you, my analysis will. What you do is you just make into a public law that every health insurance company has to spend 85%, the House has it at 90, 85% of all of their revenues on medical care. You don't have to chase around their data. They have to give you their data, and they have to give it to the Secretary of HHS, and they got to prove that they're spending the money they take in, their profits, not all their profits. That's why you make it 85%, maybe 90%, or whatever. But that most of the money they take in, they have to spend on the people they insure. What they tend to do is to get rid of people. And it's called purging. And it's a nasty process. And you don't know what's happened to you until you go to the hospital or go to your doctor and they say, well, I'm sorry, you don't have health insurance anymore. Oh, what do you mean I have health insurance? Of course I have health insurance. No, you don't. You're cut off. And they do that to millions of people. And we don't know about it. But the people who are affected by it know about it because they don't have health care. And that's a terrible curse. Fear of not having health care when you need it. And I can talk about my father actually was killed in a head-on crash. Probably a number of you have that experience with one of your parents, or both of your parents. And the only good thing to be said about that, if there's anything good to be said about it, is quick. And I was talking to Corey Palumbo, and I said, I went down to the coroner's office because I wanted to somehow reach peace within myself about his death. And it was very sudden, it hit head on, coming around the corner. And I looked at a picture of him, so I wanted to see a picture of him. And I did, and his face was completely peaceful. It was leaned back against the seat, there was no blood, it was very calm. He wasn't living, but it was calm and peaceful. Not so with my mother. Not so with my mother. That was 12 years of absolute agony for her, for all of her children, for so many of her friends. It's not fair. It is not fair that people have to spend so many years really becoming nothing in terms of their mental capacity, but still being kept alive. And that's why in all of this debate about healthcare, and so many of these people who broke up healthcare meetings, when you talk about end-of-life care, and people would start screaming, yelling at you, talk about granny killers. Well, don't try that one on me. Don't try that one on me. I didn't want to see my mother suffer. I didn't want to see my mother be kept alive when the Hippocratic Oath says nothing about curing people. It says, do no harm. And they were doing harm to her. You got to fight for Medicare in health care. It isn't just a question of health care that you do get, it's a question of the health care you might not get. Because in 2017, which is, what's that, 8 years off, in health care, that's, your father knows this, you know this. 8 years is like 2 weeks. And the Medicare trust fund is going to start disappearing. And so one of the amazing things about healthcare is that 40% of Medicare, which is this enormous pot of money now, is spent in the last 6 months of life. So is that a discussion worth having with your parents? Should your minister or your physician, your primary care physician, be allowed to discuss with your parent or us or me or Sharon what if something were to happen? What would your wishes be? What would your wishes be? What about your children? Don't they have a say? Well, right now they do. But in our case, there are 4 children. If one child disagrees, then the other children's views don't make any difference. We haven't thought about this stuff. And people start screaming when you talk about it because they think you're killing Granny. Well, it may just be that you're trying to pay your respects and show your love to Granny. And in the meantime, allowing Medicare the money to exist for a number of years to come. We passed the Children's Health Insurance Program. And that should be so easy. It affected 11 million people. 11 million kids. A kid in America is from 0 to the end of 18. And if you're really young, you really need health care. You need early screening. You need to be tested. You need to have all kinds of shots because they can tell so much more now about what you're likely to face if they can get you when you're young. And just because you're 16 or 18 doesn't mean that you're going to avoid some kind of a healthcare crisis. So the president signed that. We passed it twice. President Bush vetoed it twice. Surprise. So then in comes Obama, we passed it again, and he signs it. And I was really happy about that. I really worked hard on that. And now in the health care bill that we're doing, if we can get the Children's Health Insurance Program expanded, which I think we can, in the Senate bill, we just passed it out of 14 million kids. 14 million kids. It's a wonderful thing. It's just a wonderful thing to make sure that you know that kids are getting the health care that they deserve.